Welcome and thank you all for joining us at the Health Department's annual Poskanzer Lecture. The State University of New York at Cortland would like to respectfully acknowledge the land we occupy today at Cortland as the traditional ancestral home of the Iroquois or Haudenosaunee, right? The people of the Longhouse. In particular, we recognize the Onondaga Nation, the central firekeepers of the Six Nation Haudenosaunee Confederacy, whose ancestral territories include the land on which our institution now stands. We take the opportunity to thank the original occupants of this place for their historical and continued stewardship. Today's lecture is named for and honors Dr. Charles N. Poskanzer, Distinguished Service Professor Emeritus. Dr. Poskanzer earned his PhD at the University of Michigan, a Master's of Science from Albany State Teachers College, and an MPH from Yale University, and he started working at SUNY Cortland in 1950. He taught in the public schools in both Michigan and New York states. Dr. Poskanzer also served in World War II in Trinidad, Cuba, Panama, Hawaii, Philippines, Okinawa, Korea, and China. Indeed, well-traveled through the war. Over the next 4 decades, his accomplishments were numerous. Dr. Poskanzer was chair of the health department for many years. He pioneered a health program that became a model for our health science and health education programs at colleges across the nation. His contributions have led to the creation of the present-day system of medical health care for the aging population. He and Wilbur Cohen, a past secretary of the Department of Health, Education, and Welfare, co-authored a study which led to the passage of national Medicare legislation. Dr. Poskanzer was invited by President Johnson to attend the signing of the Medicare law passed in 1965. Dr. Poskanzer also helped establish the Medical Care Administration branch of the U.S. Public Health Service in Washington, D.C., was a consultant of the Department of Health, Education, and Welfare, and was a frequent lecturer on health issues. In 1966, he served as a visiting professor at the London School of Economics. At SUNY Cortland, Dr. Poskanzer served on nearly every standing and ad hoc committee on the Faculty Senate and what was called the Faculty Association at the time. In 1970, as the Faculty Association chair, he brought a peaceful resolution to the student unrest and occupation of the Miller Building, sparked by the tragic events at Kent State University on May 4th. He was very active in local politics and served as an alderman and then as a mayor of the city of Cortland during the 1970s. He was a longtime member and former president of the Cortland County Board of Health. Dr. Poskanzer, a specialist in healthcare administration and planning, taught in the health department for over 40 years and taught an estimated 15,000 students in that time. This lecture honors Dr. Poskanzer's contribution to health and healthcare, and it allows us to continue to shed light on critical public health issues facing us today. I will now turn it over to Professor Clark, who is going to introduce our speaker this year.
Okay, before we begin, I just want to remind you that this is a formal academic lecture. We would like for you to silence your personal devices. And unless you're taking notes for a class, please refrain from using your personal digital devices so that we can give full attention to our speaker. Do we agree?
Yes.
Yes, thank you. Mr. Richard Rivera is the Assistant to the Executive Director for Special Initiatives for the Center for Community Alternatives in White Plains, New York. The Center for Community Alternatives supports and builds people across New York State who have been affected by mass incarceration, criminalization, and community disinvestment. As a former inmate himself, Mr. Rivera is perfectly suited for this humanitarian role of supporting those reacclimated to society. Mr. Rivera has a Bachelor of Philosophy from Syracuse University and a Master's of Professional Studies from New York Theological Seminary. Mr. Rivera is the former Associate Director of Cornell's Prison Education Program. He was also the Outreach and Reentry Coordinator for Opportunities, Alternatives, and Resources of Tompkins County. He is an ethnographic researcher looking at the intersectionalities of mental health, substance abuse, and homelessness in Ithaca's homeless encampments, commonly referred to as the jungle. A social justice advocate, Richard has published scholarly articles and has appeared on several panels covering issues such as the traumatic effects of serialized parole denials to pandemics and carceral environments. It's a pleasure to introduce to you my friend and colleague, Mr. Richard Rivera.
Can you hear me? My voice doesn't carry well, but that doesn't even sound like me. I am Richard Rivera. I'm known in this area for working in the homeless encampments. I was formerly incarcerated. I'm going to tell you a little about that. But I want the trajectory of this lecture to go this way. I'm going to tell you about myself. I'm going to tell you about the work I'm doing. Then I'm going to tell you how the work I'm doing creates system change, especially in the carceral spaces, right, where people are incarcerated. I think it has a lot to do with health, and I'll tell you why in a few minutes. So this is a story about me. I served 39 years in prison. I have a couple of objections to this. Ex-Felon, I don't really like. I served 39 years in prison when I was 16 years old. I was involved in a robbery that led to the tragic death of a person. I was given 25 years. I served the 25 years, and then I was denied parole 7 times before I was released. I was 16 years old at the time. I couldn't read or write when I entered prison. The only thing I could do was smoke weed, fight, and play football. I entered prison in 1981, which is like 10 years removed from the Attica riot. So a lot of the individuals that participated in the Attica riot were there. Fortunately for me, those brothers were more militarized, more educated, and they sort of took me under the wing and encouraged me to pursue an education. In fact, they sort of coerced me to pursue an education. I said I like to smoke weed, fight, and play football. And in order to get me to go to school, they told the coaches not to let me on the team unless I went to school. And I ended up fighting with them and eventually going to school, got a GED, and started from there. When I entered prison, HIV also came in with me. Right? So 1981 and 1980, 79, people just started knowing about this disease. When I entered prison, it was in there. By the time it became a thing in prison, a lot of the individuals that sort of motivated and coerced me to pursue my education and sort of took me under the wing started disappearing. They were being isolated in the infirmary of the facility, given 2 meals a day, 2 extra meals a day, and because there was nothing else to do for them and they were just dying. So one day we sort of bribed an officer to take us up there. We went up there and we found our friends up there. I started working with HIV individuals at that time. We didn't know what it was. We didn't know about modes of transmission. The virus had yet to be identified, but that was 5 years away. Medication was 8 years away. The president mentioned it 5 years later in 1986. So it was a real crazy time. I seen hundreds of my friends die, but I also learned a lot of lessons of what it means.
A little bit more, and it's okay for you to.
All right, cool. Yeah. Sorry. So, sorry, you disrupted me. So, that experience, I watched hundreds of individuals die. I mean, it was really incredible during that period of time, and it teaches a lot about humanity and your relationship to others. So when I come to prison, I couldn't read or write, but most significantly, I didn't have an identity. So this period became a time for me to form an identity, to commit myself to values, to understand what was going on. Well, anyway, long story short, I worked with that. I published an article on that. You can find it. They also have a thing in a museum in Hollywood, California about the work that we did with HIV in prison. We ultimately developed a program in 1991 that's still the premier education program for infectious disease in prison. People get certified all the time to work with people that are HIV, Hep C, and become counselors in that work. During my incarceration, as Yolanda pointed out, I earned several degrees. I earned too many associates. Education in prison at the time was ubiquitous before 1995, and you could get involved with prison education programs, but also if you get in trouble, you get transferred to another prison. So you go over there and you get involved with the prison education program there. So this happened to me so frequently that I ended up with a bunch of associates for some reason. I ended up with a bachelor's in philosophy from Syracuse, a master's in professional study from NYTS, and just before I got released, I was working on another bachelor's in sociology from Bard College. So I got released in 2019 and went right into Cornell, where I took 2 postgraduate courses to satisfy a major track seminar for that, graduated for that. From that, then I started working in the encampments, having no job, landing in Ithaca in 2019, having been away for 39 years. I didn't know what to do, so I started hanging out with homeless people. Of course, that was the thing, and developed a design project for that population, looking at homelessness, mental health, and substance use. And I started working in the encampments, hanging out with them as an ethnographer. Anybody know what that is? So it's like anthropology. It is a form of anthropology, but instead of going to old civilization and trying to find out what they did, I go to live civilization and collect narratives and collect ideas and observe cultural practices and traditions. And I start developing and trying to understand the stories that these people tell themselves that make them exist the way they do, have the cultural practice they do, why they engage in the behaviors they do. So I started doing this in the encampment known as the Jungle here in Tompkins County. Anybody familiar with that? There's a place behind the big box stores where people have been living in that state for at least 120 years. It started with Irish migrants, the Reiners started living there. And then it had different reiterations. It became the Jungle Hobo when the train started going through there. Hobos used to get off and go in there and do their thing. And in the 80s, it became the homeless encampment known as the Jungle. Went through the crack epidemic, meth, and all this other stuff. But anyway, the population there has been there for generations. I recorded one family that had 3 generations, 2 of them born in the encampment. In fact, in 2020, just before the pandemic hit, there was a child born there to a woman whose father was born there. So that's the type of place it was. I started looking at mental health, substance use, and poverty, and it allowed me to go into a lot of intersectionalities, right? What kind of drug programs they have available in the community, what kind of housing. And 5 or 6 months after release, I was interviewing the mayor of Ithaca about affordable housing in Ithaca. We hit the pandemic hits, and I started taking care of this population, both as a researcher and as an outreach worker. We only had 1 case of COVID during that time. In collaboration with local organizations, we only had 1 case of COVID in the encampment. We were able to isolate the individual in his tent with hot water and everything he needs, do contact tracing, found 2 other individuals that we were able to quarantine in a hotel, and I converted a van I had to transport people back and forth, with plastic in the back and all that stuff, to do that. So we were very successful. We served something like 17,000 meals. We housed something like 72 people during that time, and we support them and maintain them to this day doing that. After that, I was approached by the county to do a research project on reimagining public safety. That's when this Governor Cuomo put out a thing that after the Ferguson incident, that if counties didn't come up with proposals to do policing in different ways, they were not going to get funding. Every county impaneled a commission to do that. I was part of that commission. And after I finished, it was big articles and a lot of flack because of my past. And that became a thing, right? Then I went and, in collaboration with 2 local organizations, built a reentry housing for Tompkins County called Sunflower Housing and Reentry Services for men and women, the first of its kind in Tompkins County. After that, I went to Cornell, where I became the Director of Academic Reentry Services, where I was charged with developing, implementing, and administering the reentry services, which I did for 2 years. Today, I am the Assistant Director for an organization called Center for Community Alternatives. It's a huge organization that operates across the state with an $18 million budget, 12 departments. It does both social service work and political activism. So the HALT Act, Raise the Age, Community Not Cages, all these bills that are being promoted and passed, that's our organization doing that. Currently, I'm leading a project in Westchester County in collaboration with Pace University, looking into these spaces of alternatives to incarceration and reentry. The project is funded by the Division of Criminal Justice Service. For those that don't know, the Division of Criminal Justice Service is the highest law enforcement agency in New York State. So anything that is policing and is across New York State is under them, like state police, probation, parole, docks, and stuff like that. The research project is for Westchester County and only Westchester County. The idea is to map out Westchester County services and the people they serve, to look at programs that are designed to help people, how effectively they're being administered, and the affect value they have, how well they contribute to the well-being of the individual. So we're looking at that intersectionality of services and human beings and how these institutions impact. We already know that at that intersectionality, there's a thing called civic trauma. When you go to DSS and you're poor, it's a very different experience than going anywhere else. You go in there, you sit in there, you ask for housing, you have to fill out a 52-page form, double-sided. You turn it in, wait a couple of hours, get a social worker, she starts putting mandates on you, or he starts putting mandates, and it becomes a traumatic experience for a population that really has trouble accessing these systems or can't function at the assumed level of functionality that these systems expect people to function on in order to access those services. So it creates this traumatic experiences, events at the intersectionality of service, and that's what we're looking at now. That's what we're doing in Westchester County. I started in April of 2023. It's a collaboration with Pace University. They gave us $500,000 to do this. I hired another researcher. I hired 12 students from Pace. So far, I have met 500 local organizations in Westchester County, included 150 in the map that demonstrate how it serves its populations. We have interviewed the clients, collected their narratives about how their experience was like in accessing these services, what they would like to see. We interviewed the providers, asked them what are the obstacles, how can you make this more effectively? We took the institutions and the nonprofits, deconstructed them and reconstructed them to understand where they get their funding, how they use their funding. We interviewed every county commissioner, 14 of them, Department of Parole, Department of Probation, Department of Mental Health, to see what they would like to see in the report. Do we need more discretionary fund? So when the state funds the county, they tell the county what to do. It turns out that the county administrators want to be able to do what they can do with an understanding of the cultural practices and traditions of that county. So every county, so in Hockomo County, the problem is not opiates. The problem is alcohol and meth, right? But the state will come out with funding for opiate money only. And you could only use it for opiate. Hockomo County cannot benefit from that. New York City might, but not. So these are some of the things that we're looking at and we're teasing out. So we've done that. I spoke to a lot of stakeholders, and I personally met with over 500 organizations. And that's what we're doing now. This project is unique because it is one of the first times that the Division of Criminal Justice Service is funding a qualitative research project. It's usually quantitative. We usually count numbers. And when we count numbers, we get the results that the numbers suggest, but we don't get the experience of the individuals that are going through these transitions, these interactions with criminal justice systems. So for example, when we look at returning citizens as a homogeneous group, we see that they all need certain things. There's commonalities there. There's housing, there's employment, there's transportation, there's need for a phone. When we do gender-specific research, however, and look at men and women, we find that their existential experience is different. Men and women have different motivations when they're going to get released. So women, for example, are seeking family reunification. They want to go back with their kids. As a matter of fact, if you go to the visiting room of male and females, you can actually see this. You go to male prisons, and there's all women full to capacity seeing guys. You go to women's prison, and it's mothers, aunties, and kids seeing their mothers, aunts, and child. And so it's a difference. So women want to return back to their communities and be unified with their family, but that means all boyfriends, all histories, all complexities. While guys, on the other hand, want to start new families or continue the family they started while in prison. Right? Women, for example, interpret and internalize the stigma of conviction different than guys. So when women don't want their girlfriends telling their other girlfriend about, they don't want that. While guys like me, like I just did, use it as part of our redemptive narrative, right? We say, hey, this is where I was, this is what I did, and this is how I become. And we use it that way, and we exploit the conviction while women try to hide it. So the point I'm trying to make is that this research, because of its qualitative nature, it allows us to look and gain insights into this field that we didn't have before, right? So another one is youth. What do we mean when we say youth in this criminal environment? So we know that there's a lot of cognitive research that shows that kids are going through a purging and development process between the ages of 12 to 25. There's a lot of data in that. There's Supreme Court cases on that, suggesting or directing that for the purpose of criminal justice, children are different than adults and can't be given the death penalty, for example, can't be given life without possibly a parole. And there's a whole movement around this. In fact, it's a good book on it by Brian Stevens called Just Mercy, which will probably help you with that. But what we notice now is that we have arbitrarily put 18 down as the age of distinction. So we could treat you as an adult at 18, despite the fact that the data shows that you're still going through this purging process. We just settle because we want to have kids going to the Army. We want to have those kids available for other things. But in Westchester County, for example, we have this big organization called Youth Shelter of Westchester County. And it promotes itself as the organization that serves youth that are in trouble in Westchester County, and they literally suck up every resource that is designed to go for youth services. When I started looking at this organization, they serve individuals between 18 and 25. For me, that's not a youth. When I imagine disrupting the school-to-prison pipeline, I'm thinking about those little MFs that are breaking windows at 9 and 10 years old, right? I'm not thinking of a young adult at 18, 19 to disrupt that system. And it turns out that there are kids from age 8 to 16 that are incarcerated right now. They're incarcerated under the Office of Children and Family Services. The Office of Children and Family Services is an immense agency that the state has. It deals with foster care. It deals with taking your kids. It deals with all that has to do with children. And they have 31 facilities throughout New York State where they house these kids at. Now, the discussion that I'm having in this space, the carceral space, is about docs. It's about policing. It's about Robert Brooks. It's about that. I have gone to 8 counties where I have held discussions with commissioners that are operating in this space, and every time I ask anybody here from OCFS, no one's there. Meanwhile, we have this population that's being subjected to the same disciplinary practices and technologies that we're using docs, but they don't get the benefits of any therapy or any assistance or any mentoring or anything else that people in docs get. In fact, we're arguing that those very technologies and practices of docs are traumatic, and that we should be helping people, unravel that when they come out. But the kids don't get it. And then we get the bright idea of raising the age, which I support, right? But when we raise the age, we moved another 20% of this population from this space to this space, the occluded space, right? And that's an area of concern. So that's one of the things that our research showed, that the word youth is used with such elasticity that it really is not having an impact on youth. Because the youth shelter of Westchester County that's sucking up all the money, it's really a divergent program in which kids are diverted from going to jail. They take this program and they will go free after that. The way these referrals are made is that some attorney randomly says, well, this kid is worth saving, so I'm gonna refer him to the divergent program. Then the judge will make a decision or that individual is suitable for the divergent program, which really vets it a little more, right? Then Youth Shelter of Westchester County also vets the individual. So by the time they get someone, it's the lowest hanging fruit. Did you guys know that Yonkers is the third biggest city in New York State? You didn't know that? Well, Yonkers is the third biggest city in New York State. The people that the Youth Shelter of Westchester County serves are only the lowest hanging fruit. The other 98% of the kids that are justice involved don't benefit from that. Meanwhile, the Youth Shelter of Westchester County sucks up all the funds for this population. It doesn't really deal with the real guys that are real being traumatized, that are being abused at home, that are in and out of the system because they tend to be more violent, and they'll be vetted out of the system. So these are some of the things that this research is showing. One of the most important things that this research, though, is that it's looking at from a human-centered approach, right? Don't say person-centered, don't say trauma-informed, human-centered. I think when you say human-centered, you immediately put yourself in the discourse, because you're a human being too, right? You can't but identify with that. And this human-centered approach is allowing us to value what the individual says. Ultimately, because the stories people tell about themselves, no matter how absurd and ridiculous it may appear to us, it's the truth. You know what I mean? It's based on their trauma. It's based on their history of abuse. It's based on all the things they experienced and got them to the point where they're at now. You know, and this is a lesson that we're both picking up and we hope will inspire researchers moving forward in this field to do that. As a matter of fact, I just asked for another $391,000 for this project for implementation purposes. I don't just want to produce a report, but I want to whittle down manageable ideas that we could implement in the next 3 years. So I'm asking money for that. And the idea is to continue this and produce it. When I asked for the money, the commissioner of criminal justice services said, okay, cool, we'll do that, but you have to give me the model, the research design, so I can use it in other counties. So hopefully it will be something that we'll be able to use in other counties and tease this out. The idea is that my organization, Center for Community Alternatives, you can look it up. It's pretty big, we're pretty good at what we do. We hire a lot of formerly incarcerated people, and everybody gets paid a living wage. So if you want a job that pays $25 an hour to start, you could work for us. Sorry, you can?
It should work now.
Hello? Yes. I got a mic on me, I'm wired up. These people have really done me wrong here at Cortland. So we pay everybody a living wage, and we believe this. We believe, there's our mission statement, that we cannot incarcerate our way out of social injustice and inequities. That these social justice inequities are rooted on racist past. I'm sorry that I'm dressed as a colonist today. I was told I had to put on a suit. So we are out to disturb the histories, the practice. But on another note, right, I don't know if you guys are familiar with the work of Foucault on discipline and the history of discipline. We want to disturb those disciplinary systems, right? We talk about the carceral state as if it was the only disciplinary system. But when we look through these agencies, for example, like DSS, we find that they're also embedded with disciplinary systems, right? So if you're trying to get housing and through DSS and you apply for a voucher, let's take Ithaca, for example. You go to housing, you apply for a voucher, you got to go through that whole traumatic system. They're going to put more mandates on you. One of the mandates will be that you have to call landlords, at least 5 landlords a day. All right? If you don't do that, we'll take your benefits for 90 days. All right? And most people can't do that. Most people don't have access to phone to do that or to record that or know how to do that. And most landlords just turn it off, right? Your children, right? I can't tell you how many people I'm fighting with right now who have lost their children. And it's impossible for them to get back because in order to get the children back, you must follow a bunch of mandates. You must go to drug court. And drug court require you to see 13 people in order to satisfy that. But the problem is that the scheduling to see these 13 people are dependent on the 13 people you got to see. So they will keep you there for 13 months, all 2 years, because these people do their schedules whenever they want. So these are the little triggers, right, that people in this space see as disciplinary in character and actually impact a person's life. Because if I take your benefits for 90 days, that could be the meaning between life and death. Literally. And in the encampments I work in the last 2 years, we have lost 37 people to overdoses, to suicide, to murder. It's really crazy. And it's the same population. I was just telling Mr. Clark here, Kenneth, that one of the things my research from the encampment revealed was that the population in the jungle was never more than 68 people at its height. We have over 400 people in Ithaca working to alleviate that homelessness problem. Right? So one could make the argument that this population exists to support a middle class in Ithaca. All those people making $45,000, $50,000, $60,000 working for DSS, mental health, the court system, they're all making money because this population exists. Now, what I also noticed from that research was that one of the problems in getting these individuals invested is that these agencies operate on a model. And this model has assumptions. One of them being that whoever's going to try to access those services is capable of filling out that 52-page form. That's capable to sit there for an hour or two waiting to see a social worker. You know what I mean? That doesn't have an issue. It makes this assumption that the people that are going to access those services do. The population that's chronically unhoused seems to be a population that doesn't meet those levels of expectation because of histories of trauma, because of history of mental health, because of history of just traumatic experiences with institutions. Can't access those services, and they're perpetually like that. And what ends up happening, this is how the narrative plays out. That person eventually does something crazy, hurts somebody, and goes to prison. And then DSS will be interviewing and say, oh, we gave him 5 chances. Right? And it suggests that the person is broken and the system is right. I kind of like to turn that on its head. I believe that humans are never broken. Humans are just unconventional. And that the system is broken. But this is some of the stuff that we see, right? This is some of the stuff, how individuals that are involved with the criminal justice system, involved with homelessness, involved with addiction, even being HIV positive, are immediately inscribed with a narrative, right? And that narrative that we inscribe them with affects the way we interact with them in our communities, right? There's this individual in Ithaca who is spectacular. This guy comes out dressed with sparkles on his face, a tutu, fishnet socks, everything. If you sit on the commons and watch this individual there, you will see that everyone that walks by this person goes around the person like water through a rock. They don't see him. He's so spectacular that he's invisible. He offends us so much. He's so out of place. That we don't know what to expect from that individual. And this is what we do. We're homeless all the time. Right? We see a homeless person, we do. If I was to sit up here and come in with this colonial outfit, you will never be able to say I'm formerly incarcerated. I don't like the word ex-felon, by the way. You will never be able to tell that I'm formerly incarcerated, right? But once I say it, what clicks in your mind? What do you inscribe me with, right? I don't know if you guys are familiar with the work of Frantz Fanon. No? Nobody read Fanon? Are you serious? Frantz Fanon is he's a black philosopher. He's from Martinique. He was born under French colonial rule. He becomes a psychologist. Then he goes to France. Says, I'm gonna be the man there. And he's going with his degree down the street. When a little white kid comes from behind his mother and says, Mom, look, a nigger. That stopped him on his track. Because he's perceiving himself as a man. He got a degree, he got everything going on. And that one construction deconstructed him. And in chapter 5 of Blackface, White Mask, whatever, he talks about this. He talks about how these inscriptions tell a narrative about the person. Because it's not, he calls it the gaze of the kid at the time, but it's not the gaze, right? It's the narrative behind the gaze, the one I inscribe on the person. And you could take that idea that he fleshed out there and transport it, right? When you see a woman you objectify her as a sexual object. When you see a homeless person, you want to reach in your pocket and give them a sandwich. When you find a person that's formerly incarcerated, you check your watch. You know what I mean? And we react to these narratives. So the idea that I'm trying to flesh out, and I'm trying to be conscious of this, right? Don't make any assumptions about a person just because of the way they perform in the world, right? If you see a homeless person, he may not need a sandwich. He may need a hug. She may need somebody to talk to about her child or how to get that. She may need, there's different things. And once you get to learn about these people, I think that would definitely broaden your perspective on what it means to be a human being and to be a member of a community. Which time we got? Time for a while. We have some questions here that I was giving, and I was looking through them, and I thought it was very interesting that everybody's interested in my experience in prison.
So we have some questions that our panelists have made up, and then if you also have questions, please let us know by raising your hand, and we'll be happy to hear from you. So Danye, you want to begin?
My name's Anya, and my first question is, what do you think the prison system can do to improve their education within the system?
I don't know, education, when I first went to prison, it was just right after the Attica riot, right? And just before the Attica riot, the Nixon Commission had put out a report on rehabilitation to see if it works or not. And the report was definitively rehabilitation doesn't work, right? Then the Attica riot happens, and because of the massacre there, their response was, let's give more rehabilitation. And they gave us goldfish, colleges everywhere. When I went to prison, college was everywhere. It set up a culture that I learned about Socrates at a mess hall table and got my interest in it. Then Pataki comes in and eliminates it, right? And everything went down. Now I know more about the Kardashians than I never even seen a show. Because that's all guys were speaking about, the Kardashians, the Kardashians, the Kardashians. Anyway, that's what it does. Education improves the culture of the prison system. It produces a more educated population. It shows individuals how to research, how to move, how to make their ideas into action. So yes, education in prison has been a great thing. It's a great university.
And then my second question is, what would a typical class like a day look like for you in the prison system?
Okay, in the prison system, schools, I said this often, classes are like a special space in prison, right? So everything happens within the structured, regimental, disciplinary environment. When we go to class, it's just the professor and the students. There's a humanizing effect. It's a special place for us because we could talk about things, and guys that would not normally speak in the yard because of the hierarchy and the structure of prison, this guy's convicted with this guy, they would talk in those spaces. So it becomes like a special space. Now, it's not like your typical class. There's no electronic devices. There's only books, there's papers, and there's a board, and there's chalk. And that's the way class are. Which really impacted my experience with Cornell. I expect the professors will still be doing that. They wasn't doing that.
Hello, my name is Max, and my first question for you is, while in prison, what did you have to do to earn the privilege to pursue a degree?
I had to listen to the guys that were trying to push me to education. Again, it was available to us. You could take advantage of it. I think in the way it came out again after Pataki's, colleges started coming in the year 2001 with Bard, and now the disciplinary system has affected it. Now, if you get a ticket, they won't let you go for 3 or 4 semesters. Now they're using it as as a reward and punishment thing. So now you will have to earn the privilege. When I went, you just walked into class.
And my second question is, what were your biggest challenges being a current student?
Everything. What wasn't? I think the biggest challenge I was to say is existential. Is hope. After doing time in prison, you lose hope, and hope becomes a thing that you got to look for under your bed, in the corner of your cell, in an old picture. So I think hope is the biggest thing that I needed. Yeah.
As somebody working in the helping field, what is a piece of advice that you would give to people people walking into that field?
That there's no such thing as disposable human beings, that everybody's worthy of being treated with respect, that we shouldn't make assumptions about others, and that you should most definitely understand your relationship to others in the world. I think it's very important. It's just, talk to people, listen to them, engage people. Don't walk by people try to make eye contact. I go to Wegmans, no one makes eye contact. I go to Walmart, especially on Fridays, you got a lot of immigrants, everybody makes eye contact. Everybody looks at themselves in the face. It's a different demographic. Questions? Any more questions?
What was your biggest inspiration to work with the homeless and re-entry population?
My own personal experience, right? Now, I went to the board 7 times. In fact, I wrote an article, it's in the CUNY Law Review. I think it was published 2002, something like that. And it talks about the traumatizing effect of that, right? And it's a really dehumanizing effect. When you go to the parole board, you don't go to the parole board as much as you do to get released, but as much as you do to get validated as a human being. So if I did something horrible years ago and I come to the board and I'm saying, yo, this is me now, and you deny me parole, you invalidated me. You invalidated everything I've done, everything I produced in front of you. Existentially, you invalidated me as a human being. So I think, I think that's one of the things, yeah.
How did you utilize your free time in prison?
I did everything. I became a master origamist. I draw, I paint, I fix things, I do wood, I do all kind of hobby stuff. Yeah, it gives a lot of time in your hand. I did 12 and a half years in the box. So that's solitary confinement. So out of 39 years, I did 12 and a half in the box, not continuously. A year here, 2 years there, 3 years over here, 8 months here, like that. And that's why the only thing you're allowed to have is paper, so I became an origamist and started doing stuff all over the place.
Can you explain what you mean by solitary confinement? I'm not sure.
Solitary confinement is when you're deemed to have violated one of the rules or resisted or engaged on a strike, a riot, or any of that stuff. Their idea is to put you in isolation for 23 hours a day. In fact, Governor Pataki engaged in the biggest prison building program in the history of the United States, and he produced 5,000 new solitary confinement cells, whole institutions of it. So, yeah, I spent a lot of time there. Thank you for that question.
What type of life skills did you learn incarcerated that you still possess today? And how did those skills apply?
I think the ability to be able to talk to people in different spaces, a person that can't read or write, to a person that can read or write, to a person that's very educated, to a person who's obnoxious, to different people. When you're working in an AIDS ward in prison, none of that makes a fucking difference. None of that makes a difference, right? People are dying of the most outrageous diseases. I don't know if you know what AIDS is, but it compromises your immune system to the degree that infectious diseases that would not normally hurt you would hurt you. So I walk into a room and this person got pus leaking out their eye, or their leg is so big it looks like a ripe fruit. I mean, weird stuff. Cancer, Kaposi's sarcoma, all these other stuff happening. Sorry, what was your question again?
What type of life skills did you learn?
Yeah, so I learned how to be able to communicate with human beings in kind of different levels. So if I was in the box, I was working in the grievance program where the job was to resolve conflict between staff and prisoners. So a lot of individuals get frustrated. To talk to individuals, to understand, to listen, is perhaps the biggest skill I have. I know how to do things. Listening is the one we gotta learn.
Other questions? Yes.
How do you feel when you hear about politicians making light of the fact that the incarcerated individuals have access to these educational programs at a reduced cost, or that they shouldn't have access to educational programs at all?
Yeah, that's an old argument. I think education should be universal and free, by the way. Right? I think everybody should have it. I think you got both sides of the argument, I think, have valid points, right? We are getting a free education, right? but we're also transforming lives. So it depends on what side of the argument you want to land in. I think it's very transformative. I couldn't write my own last name when I got arrested. I was running the streets when I was like 7 years old. By the time I was 16, that's when this crime happened. So I couldn't write my own last name. I could produce anything I want to produce now, right? I took advantage of the educational opportunity. It was disrupted a lot, but I took advantage of it. And I just think it's something that should be given to everyone. And making it available in prison is really transformative. And right now, the zeitgeist is to commodify individuals with lived experience. So individuals, if you was to go for a job, and she was to go for a job, and she was formerly incarcerated, you make a great gangster, by the way, she will get the job before you do because of her lived experience. Because the idea is that a person could understand a person that's coming from that space, right? Better than a person who has not. I don't know the validity of that argument. I've seen some people that just came out of academia that has been better than individuals with lived experience.
More questions? Yes.
Thank you for being here. And it's great to hear about the on-the-ground work you're doing, that's graphic work. I feel like there's a lot of value in the larger academic research field stuff. You mentioned the parole board and how going out to parole and being denied all the time can really chip away at someone's mental health. What do you think changes could be made for the process?
Cool. Well, in the article that I wrote, I actually made that argument. I'm saying that it's unconstitutional because the state is not charged with imposing a mental health crisis on you, right? I think the more transparent, if you remove the subjectivity of the parole board process, but then how do you quantify change, right? How do you quantify that an individual has a demonstrated? So in my case, I went to prison when I was 16. I go to the board, and I'm in my 40s, whatever, right? I get hit, then it dawns on me, because I'm doing all this research on youth, that, hey, they're not seeing me. This thing that I said earlier, that the court has ruled or recognized that for the purpose of criminal justice, youth are different than adults, is not being applied at the parole board. And that was my challenge. And the court went for it. The Second Department, 2019, Rivera versus Stanford, the court did an analysis and said, wait a minute, these are different individuals. And for them, what we're going to do is set this two-pronged standard. First, to see if the crime is mitigated by the factors of youthfulness, impulsiveness, whatever, and whether the individual has matured since then. So that's one way of quantifying it, right? Whether we could do it with kids, whether it was due to the factors of youthfulness or whether the individual has matured. When I went to the board, when I got arrested, I couldn't read or write. When I went to the board, I had a master's degree, I had published articles, I have done continuous research within the prison population, because I thought I was at great advantage to be in there. So using those two standards, it was a presumption of release. The board, we have to remove the subjectivity of it. There has to be ways of incentivizing individuals. Behaviors change. When I entered prison, I said I didn't have no education, I didn't have an identity. My identity formed while in prison. Judging, seeing behavior, experiencing stuff, and I formed my identity. Most individuals you will interview who have had transformative experience in prison, that's what they're talking about. They're talking about a change in identity, right? Change in moral commitments that defines their behaviors and the way they perceive the world and all that. I think that may be something, incentivize that, right? Let's do that in youth centers, right? Let's take those kids that are under carceral spaces right now, and why not help them build an identity? Maybe that's what they need, right? Maybe those are the type of services that they need. So these are some of the things we're looking at. How to change the parole, I don't know. But I do know this. I know that my article is being used in New York State, Flores versus Stanford, and in Ohio State to change parole practices because of that very thing, that they are imposing a mental health crisis on people.
You went through both the HIV and COVID pandemic. What was different about the way it was handled?
Yeah, that was really bad for me. I messed up on that one. All right, so I work with the HIV, like I told you, and I come out in 2019, and COVID hits, right? And I'm still in touch with people in prison, and I was invited to speak at the UN International School on carceral spaces and pandemics. Right? At that time, I had published an article already on HIV experience. And I made the prediction that because histories of experimentation with people of color in spaces like prisons, most individuals would not be too happy to take the vaccine. So I don't think there will be a rush. This was my prediction that I made. Sounds very smart, right? What I didn't consider was that during the pandemic, Department of Correction has suspended parole board hearings, family reunion visits, visitations, school programs, and all this. So as soon as the vaccine came out, there was this huge rush of individuals to get the vaccine. So yeah, it was different, but it was motivated by different things, right? So, but after that, the rush kind of tickled off. So it was like 10% of the population went, but then the other 90%, because of histories of experimentation with that, they didn't go for it. So it was different.
Do you know of any early administration of the vaccine in prisons?
Yeah, I was, for the first ones, yes. I was given Fitskill Correctional Facility was one of the first ones that was given. But they have a puppy program where guys teach service dogs. They have college. They have visitations. It's real close to New York. So there was a mad rush to get vaccinated to get these programs started again because the facility operates like that, right? It's always disciplinary. You do this, we give you that. Here's the carrot, and there's the stick. Here's the carrot, and there's the stick. So that's why it was different, those two experiences.
Can you talk a little bit about what faculty and what an institution needs to do to prepare for a prison education program?
I think they're models. Right now, SUNY, you should be real proud of yourself. SUNY educates 50% of the prison population in New York State. You got the big programs. You got like Bard, Cornell got a program in there. But SUNY system with Rachel Sanders do like 50% of the population. In fact, they just came out with a report. Dr. Geis, Thomas Geis from SUNY, just came out with a report. And I believe everything he says. I think if you're doing 50% of the population, that's a representative group. So whatever's happening in your place there. So I will go to SUNY to get information on how to start a program in prison. Because you guys have any particular recommendations? Well, I think the space should always be no police involved in the space. No police. Right? The space should always be a way to treat individuals like human beings. One thing about prison is they read every text. You give them a text. I don't know what these guys are doing over there, but you give us a text, we're going to read the whole text.
They don't even buy the book.
Exactly, because everything has to be written out. So I have to type out my reports. So I have to have all my facts. And there's only 10, 15 guys in a room, so the teacher's not missing anybody. Right? So it's really a different environment, but it's such a humane and such an inspiring environment that guys generally succeed. Look at all the information. I haven't pulled out a note. I didn't bring no slides. You keep all the information in your head, right? That's one thing you learn about prison too, never take notes. That's why I'm wired up right now. It's probably got me wired up. More questions? Anything curious about prison that you want to know about?
Yeah. How do you think that the pay-to-stay system affects people like Senator?
What?
The pay-to-stay system, or like
Oh, you got prisons that make you pay co-pay, you mean? Like a co-pay, like if you go to sick call, it's medical, you got to pay some $5 out of that, or to pay. I don't know how that'll work. The ones that do that is private prison industry, which ironically had the same acronym that we have. It's called Corrections Corporation of America. I'm Center for Community Alternatives, so CCA. We got to change that at some point. But they do that. And they operate systems at minimum wages. So the correction officers are paid minimum wages. Medical staff, non-existent unless it's an emergency. Food is really subpar. Everything is run on profit. New York State has never had a private prison operating in the state. And that's a good thing, I believe.
What do you think about, so federally there's a lot of talk about privatizing, the corrections in the United States. What do you think about that?
I think it's a terrible idea. I think it's a horrible, at least to the stuff that's being done in El Salvador. I don't know if you're familiar with it. They built this supermax prison in El Salvador, And everyone that's there, if you have a tattoo, you're going to be there. And this is how you sit all day long. For 23 hours a day. There's no beds, no mattress in the cell. You're packed to the rim that everybody has to sit like this. And this is what privatization of prison will lead to. It's that slippery slope that once we start dehumanizing, we can't seem to stop doing it. Yeah.
Rachel is my hero. Thank you very much for the work that you've done, especially before Palm and Matt were reinstated, and we're really working against the grain, even more so than we are now, to get a education program going. So a couple of questions. One, when you were incarcerated and all the associate's degrees that you went through, what was one program that you found most beneficial when you were returning, or one that you would have liked to see as we work to develop our bachelor's program in Auburn? And my other question is, you talked a lot about gender-specific research with folks who are returning. Has CCA done any work around trans folks that are returning?
No, but this project has spoken to people. As a matter of fact, my next focus groups is Bedford Hills, Taconic, and Albion, which are female prisons, because it's hard, because they melt back into the community. It's hard to find a focus group of women in the community. The numbers are very small. Out of 31,000 people in prison right now in New York State, only 1,200 are women. Only 29 are from Westchester County. Who's going to build a reentry program for women that are presumably coming within the next 5 years? It's not going to happen. So it's really this lack of services. So I'm trying to find different and innovative ways. One of the ideas I'm proposing is to identify an organization that already services women and protects women in this way, to fund them, to have a department attached to them. But maybe that will work. But your first question was, yes. For me, personally, my degree in philosophy was the most. That's my best. I got one in sociology, one in professional studies, counseling, whatever. But that one helped me a lot. I think philosophy got me through it. I eventually read every philosopher for the last 2,500 years. Camus, for example, was very inspirational. Kafka made the world understandable. So it went like that, you know. So philosophy is always good. It's only going to be doing humanities, because you can't do astronomy in prison. You're not going to bring in the cameras or the equipment. So it's going to be non-equipment stuff. And I think humanities is always, all right, cool. Thank you. Anything else?
More questions. If not, let's give Mr. Rivera a round of applause.
Thank you so much for having me here. Thank you so much for having me here. Y'all been great. I'm really honored and humbled by this experience. You become part of my, the trajectory of my journey.